So today our topic is abnormal development, and this relates to abnormal behaviour that children can display due to biological factors, personal experiences, environment and a range of internal and external variables. In this presentation we will explore some of the abnormal behaviours and developments, the reasons why and the possible causes of such abnormal behaviours.
There are 5 topics we have chosen to critically discuss and evaluate. These topics are risk, vulnerability and resilience, attention problems focusing on ADHD, internalising problems, externalising problems, and gender differences.
So the first topic is risk, resilience and vulnerability. Resilience has no single universal definition, but it can be described as the reaction and adaptation following trauma or adversity. Resilience is developed through significant challenges to development. These include poverty or being part of an oppressed group in society, disability, maltreatment from parents or caregiver, children of alcoholics and symptoms of ADHD. Children who experience these risk factors are more vulnerable to experiencing abnormal development. What makes a resilient person? Stressful life events and a strong support system of others promotes resilience in young adulthood. Children and young people who are more resilient when faced with stress and trauma are socially competent, autonomous, have effective problem-solving skills and a sense of purpose and future. They also experience positive interactions within school and are involved in pro-social organisations. Resilient children will most likely show internal characteristics such as intellectual functioning, self-efficacy and an appealing disposition. They will also have external factors like good relationship with parents and socio-economic advantages. These build and develop competence and resilience in young adulthood. Few other characteristics: they'll have a positive attitude towards life, easygoing temperament, they'll challenge negative thoughts, have pro-social skills, are self-aware, will manage feelings and stress positively, and decision making and recognising consequences. Research has suggested that genetic, environmental and external factors work alongside individual characteristics to all interrelate and contribute to the development of resilience in individuals. This would suggest a difficulty in defining what exactly contributes to an individual's level of resilience, as so many factors can come into play. So the evaluation for risk, resilience and vulnerability. Causation. Are children resilient due to having these characteristics, or do they develop these characteristics through being resilient? This is the same case with resilience and the experience of tragic events. Which came first? Previous studies haven't focused in enough on the vulnerability and resilience differences between males and females, and whether gender is an extraneous variable on these characteristics or not. Further studies have suggested that the contribution that gender has towards resilience is overall difficult to evaluate. This is due to studies differentiating in design and participant population. For example, studies into maltreatment and resilience focus predominantly on female samples. Other studies into characteristics of resilience do not offer an explanation for those children who show resilience despite not having the said characteristics or experiencing the given internal and external factors that the research has highlighted. Research into this area focuses heavily on children, or use children or the child's caregiver to gather information. This can be difficult and unreliable, as it could be said that children are too young to understand and give a reliable report, and their caregiver's reports may come under scrutiny for social desirability biases. Other research into resilience suggests that children have different vulnerabilities and protective systems at different ages and points in their own development, so using longitudinal study design in future research will be most effective in order to gain a better understanding around risk factors and the development of resilience for children at different points in their life. Previous studies have highlighted that future research into the topic would benefit from using a multidisciplinary approach in order to gain a broader, more in-depth picture of the development of resilience. Another point for future research was that it needs to investigate cultural differences, socio-economic differences and ethnic minorities in relation to the risk factors and the development of resilience, and how this can be a factor in an individual's vulnerability to abnormal development. These are the references for the risk, resilience and vulnerability, and I'm Danielle Salkeld.
The second topic is the causes of ADHD. Attention deficit hyperactivity disorder is one of the highest diagnosed neurological disorders. Treatment for ADHD can be use of drugs such as Ritalin, which is the most used drug, and non drug treatment can be mindfulness and cognitive behavioural therapy. The causes of ADHD can be biological. There is evidence from family, twin and adoption studies to suggest that ADHD is inherited, and there has been research to suggest that at least 20 potential genes have so far been studied in relation to ADHD. Some research has suggested different genes are responsible, such as the GRIN2A and dopamine transporter genes, which have been found to increase the risk of ADHD. This research shows that there is a strong link to genetics and the development of ADHD. The criticisms of the literature is although the research has found evidence for a genetic link, all research states that there was a link, but either there was more tests needed to confirm it or it was too complex to completely confirm the link. Also, a lot of the research found that it was a non-biological effect, but also environmental had a part to play in it, which would indicate that biological is not just the only cause. Future research is definitely needed, as biological causes do not have sufficient evidence to confirm that it is the cause of ADHD. Another cause for ADHD is environmental. Many researchers have investigated the effects of environmental factors causing ADHD. Some research suggests that being in a low-income family and or in a lower social class can influence the development. Research has suggested that parental attachment problems have been found to be the cause, and a negative child-parent relationship and a dysfunction within the family can contribute to the development. All these factors have been found to be the cause of ADHD. Criticisms of the environmental causes are, in the research, it is not made clear why low income and social class influences the development of ADHD. This is vital to understand why this is the cause. Also, the literature seems to suggest that more research is needed to confirm the idea that environmental factors are the cause of ADHD. There is a lack of evidence that environmental factors are the exclusive cause of ADHD. This seems to be a running theme throughout the research into the cause. More research and studies are needed in both areas to be able to answer the question of what causes ADHD. The future research could be that both biological and environmental causes need further research, and both have no definitive cause and both cross over into each other and cannot be confirmed if it is the cause. More research is needed in both areas, as there is still a lot of gaps in the research. In nearly all the literature, they discuss that both environmental and biological causes are not without the other, so research could be conducted into both causes together. Future research could also include more biological testing on genes, as research stated different types of genes are responsible. An environmental cause could study effect of home life across classes and compare the differences. If there is an environmental factor, such as parental attachment problems, then interventions could be developed to prevent ADHD. These are the references for ADHD, and I'm Katie Taylor.
Internalising problems. This refers to negative behaviours focused inwards on the self, resulting in disorders such as anxiety, depression, and eating disorders. Development of internalising issues in childhood has been found to correspond with further, more serious internalising issues in adolescence, often beginning with anxiety and developing into depression. Similar studies found older children tend to have combined depression and anxiety, whereas anxiety alone was seen more often in younger children. Furthermore, studies show continuous internalising problems in adolescents can, and often do, progress into major depressive disorders, raising the question of, if there is enough help and awareness for those with internalising problems, why are there still so many lifelong sufferers? Statistics would indicate that depressed parents are more likely to have depressed children. Sullivan, Neal and Kindler 2000 found a link between genetics and major depression in their adoption studies. However, environment was also found to be a major influence. Cole, 1999, found a correlation between negative cognitions and self-competence, both brought on by stress. Hilsman and Garber, 1995, used the diathesis stress model to attempt to explain internalising disorders as the result of an interaction between a predispositional vulnerability and a stress caused by a life experience. In this sense, each individual would be naturally predisposed to either be resilient or sensitive to development of internalizing problems, as well as influenced by the external factors. Studies show that children and adolescents are most at risk of developing internalizing problems as they progress through sensitive years, with a number of social, biological, and emotional challenges to overcome. Consequences include significant daily impairment, interference with interpersonal and academic functioning, drug and alcohol abuse, self-harm, and even suicide. Cognitive behavioural therapy is a highly effective intervention and treatment for internalising issues. Numerous studies found its highly flexible nature was useful in the treatment of patients. Van der Voort, 1997, referred to maternal sensitivity in childhood as the most important factor for preventing internalising problems. However, biologists would argue this would not fight genetics and that drug treatment is required to equal out any hormonal imbalances.
Externalizing behavior in abnormal development. Externalizing disorders are mental disorders characterized by externalizing behaviors. A well-known distinction in the field of child psychology and psychiatry is the distinction between externalizing and internalizing disorders. The construct of externalizing behavior problems refers to a grouping of behavior problems that are manifested in children's outward behavior and reflect the child negatively acting on the external environment. The idea that behavioral disinhibition constitutes a generalized vulnerability to externalizing disorders has gained wide currency and consistent empirical support. One of the most important components of conduct disorder that children develop and express is aggression. Studies show that childhood aggression is a strong predictor for adult crime and violence. Unfortunately, externalized behavior in childhood has long-term significance beyond the strain and struggle it brings to daily life. When it comes to this topic, psychologists focus their attention in three major areas of externalized behavior: trajectory of behavior, quality of parenting, and genetics. Moving on to the research focused, first we have trajectory of behavior, where research shows that latent class analysis identify 5 classes with distinct developmental patterns. Anne Kjellson in 2009 has conducted a study which aimed to examine the long-term prediction of well-being from trajectories of externalized behaviors problems. The study has a total number of 921 children, and the findings show that a high stable trajectory of externalized behavior from infancy to mid-adolescence predicted lower scores on life satisfaction for both boys and girls, and it also predicted higher levels of depression and aggression in boys and anxiety in girls. Another similar study, conducted by Johnny Reef in 2010, examined externalized behavior trajectories in order to predict adult mental disorders. This was a longitudinal study over the period of 24 years and included 2,076 children. The findings showed that all externalized behavior types showed significant associations with disruptive disorder in adulthood. In all antisocial behavior types, high-level trajectories showed the highest probability for predicting adult disorders. Moreover, even though the trajectories most often predicted disruptive disorders in adulthood, like in the previous study, it predicted anxiety, depression, and mood changes. Next, we have quality of parenting. Childhood exposure to violence is often experienced in different contexts, but a major factor that leads to this kind of exposure is the quality of parenting. Studies show that a significant interaction between direct and indirect violent exposure to violence. Moreover, children with either antisocial or alcoholic parents were at the greatest risk of externalizing behavior. Therefore, bad parenting increases the chance of a child to develop this type of behavior. The genetic nature of individual differences in behavior disinhibition has been demonstrated by Kruger in 2002. In 2005, he also took part in conducting an experiment which suggested that adolescent maladjustment is influenced by genetic factors. This affirmation has been backed up by another interesting study, where it has been found that parents may pass down to their children the genes that are involved in the development of antisocial behavior. The findings of these studies should be interpreted in the light of some limitations. The majority of findings stop following the children before adolescence. The findings need to be consistent in order for them to be able to be generalized to the whole population. In the other case, longitudinal studies have some limitations as well. We need to take into consideration that when interpreting results in a longitudinal population-based study, high-risk participants are the most difficult to keep included, which was the case with these studies. The results may not generalize to high-risk population because some cases with severe externalizing problems were not included in the studies. Another important factor that is considered a threat to external validity when it comes to longitudinal studies is that the results may have been influenced by time-dependent environmental covariates such as economic growth, ethnic distribution, or family structures, which have not been taken into consideration in the presented studies. Future research suggests focusing on areas such as replication of findings, preventive interventions that need to start very early in life, and also to address the risk of externalizing behaviors due to cumulative violence exposure.
Gender differences in ADHD. Abnormal development can affect us differently depending on our gender. For example, statistically, many development issues affect more boys than girls. The following slide will focus on the abnormal development attention deficit hyperactivity disorder, which is more commonly known as ADHD. Surveys of children between the age of 5 to 15 years old show that 3.62% of boys and 0.85% of girls have ADHD in the UK. This displays the gender difference between boys who suffer from ADHD far more likely than girls. Both studies found that boys who suffer from ADHD show more severe symptoms of the condition than girls, and typically, more males with ADHD experience more intense hyperactive symptoms. On the other hand, females tend to be quite the opposite, displaying lack of concentration and interest, and have shown higher rates of self-reported anxiety symptoms. In addition, it was also identified that girls with ADHD show less overall symptoms as compared to boys. However, these studies lack external validity due to the common theme of using school-based observed behaviour. This restricts the findings as it cannot be applied to outside of the school setting, which may lead to the fact that these behaviours cannot be shown outside of the school setting, or the intensity of it might be higher or lower. Although studies have failed to identify a clear link between the difference in parenting styles between mother and father and the effect on the development of ADHD, it is, however, being discovered that different types of parenting styles can have an impact on children delinquency, which has been found to closely link with ADHD. Significant links between parenting practices and oppositional defiant disorder, which also commonly associated with ADHD, may explain why ADHD can develop and progress. It was discovered that certain types of parenting styles, for example, harsh parenting, is related to more externalizing problems for boys than it is girls. A similar study suggested that inadequate parenting amplifies the vulnerability and misbehavior risk factors, again, of males more than it does females. Interestingly, studies have reported that mothers and fathers have different attitudes towards ADHD depending on the gender of the child. For example, fathers who have sons who suffer from ADHD commonly experience denial and are likely to recognise the symptoms of ADHD as a typical behaviour of boys. This can influence the child with ADHD, as it means that boys can be overlooked and not receive the appropriate treatment. However, it has been discovered that fathers are more likely to take part in medication vacations with their sons who suffer from ADHD as compared to their daughters. In conclusion, further research is needed to explore gender differences in adults who have ADHD, as most of the studies concentrate on young children. In addition, more research needs to be obtained of the effects of parenting styles of mother and father and the effect on the development and progression of ADHD in children. So, to conclude, I'm going to go over the main gaps in the literature we have found, which have become a common theme across the slides. For example, studies have shown there is a lack of either female or male participants. An example of this is within ADHD studies, which predominantly focuses on males. However, we do understand an explanation for this may be due to the lack of females with ADHD. Although this is a limitation, it can also be a positive aspect, because there are variations within the statistics of gender-related abnormal behaviour. It means that studies have focused on the gender where they will find the most participants, which is likely to make their studies stronger and more accurate. Studies on abnormal development in general tend to focus on children and seem to lack studies on teenagers and adults. Again, although this is a limitation, this could also be a positive aspect. This is because we are talking about a development of a disorder, which is likely to begin in childhood. However, it would be beneficial to include teenagers and adults. This is so we can see how these disorders develop over time. And finally, with every research area as a whole, more research is needed to ensure any gaps are covered.
I'm Katie Taylor, and my reflection is, I only met up with the group outside of the seminars once. This is because I have bad time management and organisation skills. I work as well as attend university, and this reflects my bad time management and organisation skills, as I find it hard to manage university, work, and to complete university assignments. If I had better time management and organisation, I would be able to fit in time for more group work. This is something I need to work on, as I'm going into third year will mean that I must manage all my university work, my dissertation and my job without falling behind on any.
I'm Danielle Solkeld, and this is my reflection. So within this group project, I felt confident in my organisational skills, but one thing I tend to struggle with as a whole is group work. This is because I work better on individual tasks, as it allows me to keep everything organised and I don't have to depend on other people to hand in their work in plenty of time. This is something I will continue to work on, as it is vital in any future employment and career, as there will always be an aspect of group work in any job.
I often struggle with group work, as I work best alone when I can control my own time management and structure of work. Within this group, I found it difficult to keep track of the work progression, as everyone works in their own style and at different speeds. However, I do think this group work has allowed me to be more open to new ideas and flexible and able to keep up with demands as you relied upon your group. As I progress into third year, I feel my skills with time management could improve. However, I am already feeling more confident in my group work.
Considering the fact that this was the first group assignment where we were required to video or record ourselves, I consider I had a lot to learn from this experience. I'm also working on my time management skills, and I can say that I'm not the best when it comes to group work, but I have tried my best, and I'm feeling good that I have accomplished another step towards completing my degree. In the future, I will try to be more aware of all the factors that involve group work and try to put more time in it as well.
I feel as though I struggled with this group project, as firstly this is because of having to do something new, which is recording a video, and I also felt the topic I had chosen didn't work very well for me. In the future I will do extra research on the design of the assessment, and also I'll ensure I feel comfortable in my topic area and will not be afraid to ask any questions.